Well, I was in the hospital for about a week with the 2 separate days of stent procedures were taking place. And I guess more or less I was just feeling depressed. I was always wondering, you know, am I really going to be okay in the future? Is my life going to pick up where it left off, or am I going to have to kind of curtail some of the things I enjoy doing?
I had 3 stents put in my heart, and it's been doing pretty good since then.
I had a valve replacement.
When you know you're overweight, you know you just had a heart attack, and sometimes that is reversible. If you don't change, you're going to be back again, or dead, one of the two.
I figured possibly I could, you know, get back on track on my own. And there was a lapse of maybe a month between getting out of the hospital and eventually starting rehab. And not much was going on with me. I just kind of was in a slump at that point in time.
Because I've been a gym person. Been attending a gym for years, and I was concerned that I couldn't go back to the gym, but I just immediately I said, I will be here.
I really wanted to do it because of the weights and stuff, because of getting me ready to go back to work, because I don't want to go into work and not be prepared.
We bring people in who have varying degrees of heart disease, and we exercise them while they're monitored. And that's not the only thing we do. We also provide education on managing their risk factors for heart disease, and also provide them with emotional support.
Day one, we sit down, we go through all their paperwork, assess them, try and see, you know, where they're coming from. We do some surveys that evaluate them mentally too, and emotionally how they're feeling, because a lot of times people feel a little depressed. And then we have a total of 3 orientation visits. That first one is included in that, and we set up different pieces of equipment and see what they can do, where we should start them, how many minutes on, and what pieces of equipment. And then after the first 3 visits, they start coming Monday, Wednesday, and Friday, more in a group setting.
Not only was I starting to see gradual changes physically, but emotionally too.
But yes, I look forward to being able to approach the next step, and I did.
They taught me to exercise.
By coming to rehab, we're going to give you the tools to help you stay out of the hospital and to help you avoid further heart problems.
Went to their courses on diet, everything else, so I was able to maintain pretty decently, and it just made a new lifestyle for me.
We want them to be able, when they leave here, know, okay, I need to have my blood sugar at this level. I know what to eat to keep my blood sugar there. I know to avoid salt to help keep my blood pressure down. I know what medications I have to stay on for the rest of my life.
But I definitely read food labels more so now.
But you need to eliminate the reason why you got the clogs in the first place. And what we do here is try to work with patients to reduce risk factors, get the blood pressure down, get the cholesterol within goal, help them with weight loss, help them develop an exercise program that will bring all these things together, get diabetes under control.
We want people to get back doing what they were doing prior to their heart event.
We finally got some studies that prove that people who come to cardiac rehab after bypass and after stents actually do live longer than people who don't come to any kind of formal exercise program.
I actually was hoping it would be a little bit longer than what I am here, but once you get started, it really makes you feel good.
You cannot go to, say, a private gym and get the same benefits as what this program supplies, because here you are getting constantly monitored while you're doing the exercise. You're definitely receiving areas of counseling that you might need.
I'm a new person. I truly believe that, and I attribute it to the people in here.
If people don't have a healthy heart, they're going to have limitations and not be able to live life to the fullest.